Okay, so I'm going to explain the difference between closed glottis pushing breathing and open glottis pushing breathing. Closed glottis is when we hold our breath like that, seal the lips, and bear down as hard as you can, also known as purple pushing. And what happens with closed glottis pushing is when we hold our breath, the pelvic floor gets kind of rigid. And so we're trying to push the baby's head out against a rigid muscle. Whereas open glottis pushing, we're inhaling and we're exhaling during the push to open up the muscles so the baby's head can pass down more effectively. Closed glottis pushing is historically what is taught for vaginal delivery, and it's indicated when the baby needs to come out quickly. And there's a sense of urgency of getting the baby out. That is when closed glottis pushing is indicated, which can cause increased blood pressure, decreased heart rate, and decreased oxygen flow to the mom and the baby, which is one of the reasons why open glottis pushing is preferred if the baby doesn't need to come out extremely quick. Open glottis pushing is when we inhale, belly expands for 5, 1, 2, 3, 4, 5, as we exhale from the back of the throat. That is when we are thinking of the push phase. The cues I like to use for the push phase is, imagine you're pushing out a tampon. Imagine you're having a bowel movement and you're bearing down. So it's inhale, the belly expands, the pelvic floor is lengthening, and then exhale through the back of the throat. And that's when you're imagining pushing a tampon out, having a bowel movement. Different cues work better for different people, so sometimes it's good to offer up different cues and see what makes sense best for the mom. The advantages of open glottis pushing breathing is it's better for mother and baby's heart rate, blood pressure, and oxygen levels. The mom feels more in control because she's controlling the muscles and the breathing, and it is better for the pelvic floor with decreased risks of tearing and trauma to the pelvic floor. The clinical practice guidelines for obstetric nursing, it says that open glottis pushing breathing is the preferred method over closed glottis pushing unless the baby has to come out immediately. Okay.
Good.